But first, Canada's push for improved maternal and child health care last week seems a little at odds with the minister's statement today. Christian Paradis, the minister in charge of foreign aid, and he says no overseas projects will be funded to help war rape victims or child brides obtain abortions. Let's bring in the MPs for their view. For the NDP, MP Jean Crowther is here in the studio with me. The Liberals' health critic is Hedy Fry. She joins me from Vancouver. The Conservatives, unfortunately, could not find an MP in time for today's show. Let's go to you, Hedy Fry, first. Do you see an incongruity here between Stephen Harper's push to help maternal health as well as children and this position by the minister?
Absolutely, there is an incongruity. The problem is that Stephen Harper has praised himself and his government for taking this position in helping women and children around the world. But they're not listening to what the evidence is saying. Or the United Nations Security Council, NGOs, including groups from Europe and all of the countries of the world, governmental bodies and parliamentary assemblies have asked him to fund the full range of reproductive health that is necessary for women in the developing world, and to fund it based on evidence and not based on ideology. And he is doing the exact opposite. He's allowing ideology to stand in the way of decision-making based on good scientific evidence and on all of the spectrum of reproductive health programs that women should be able to avail themselves of.
Jean Crowther?
Well, you've got a Prime Minister who claims that child and maternal health are a priority for this government. You've got a Foreign Affairs Minister who has been out speaking strongly against child brides. And then you've got a government who simply won't support women when they have to make a very difficult choice. And the World Health Organization says something like 13% of maternal deaths are related to lack of adequate access to abortion services.
Hedy, is this a new policy? I always thought the government said, look, we'll allow agencies that refer these child brides or these rape victims to abortion clinics, but it sounds like it's going to be a more blanket ban now. What's your reading of what? Is it still confusing to you, or do you see what's going to happen?
It's not confusing at all. It's very consistent with this government policy, which is we will allow ideology to dictate what we do. We've seen the Minister of Health interfering this week in clinical guidelines between physicians and patients as to what drugs patients should have or not. We've seen this minister talking about what they will and will not provide. And the point is, if you're going to fund, you should fund, especially in areas where you're trying to deal with maternal and child health, you should fund what the evidence says should be funded, what clinical guidelines say should be funded, and what it is that the countries whom you're giving the money to need for their people. And you cannot continue to tell them what they can and cannot do and cherry pick what you think is good because of ideology. And ideology drives everything this government does, which is a very dangerous precedent.
I was under the impression, I mean, there are countries, though, Jean, where abortion is outlawed. And I don't know if Canada should be funding agencies that are breaking the law in those countries. Should we?
Well, I think, again, the agencies who are working on the ground in the countries are in the best position to judge what kind of services are needed for women in those countries. Those organizations work closely with women's organizations. We know that in some countries that although it may not be legal, women are still accessing those services one way or another. And the women on the ground, the service providers on the ground are in the best position to know what they should be doing. This government is simply taking another run at its very, not very well hidden approach to abortion services.
I don't want to think this is just ideological, Hedy Fry. How pressing is the need for abortion services in some of these countries that need foreign aid, particularly from Canada? Is there a lot going on, and is a lot of abortions being turned down and child brides left with unwanted pregnancies for want of money?
Well, there was a clear guideline, actually, Don, that came out of the African Health Ministers Conference about 3 years ago, where they said that abortion should be funded in countries where it's legal. So they have said that this is appropriate. And you cannot have the Minister of CEDA and or the Prime Minister of Canada saying, we will make a blanket statement that says you cannot do it. It should be allowable where it's legal, which is what the African Ministers of Health said. So why is this Prime Minister making it up on his own ideological grounds as he moves forward, denying women access to something that is or may be legal in their own country? It's all about ideology, and it is harming people and harming outcomes. And if what his aim is to give money to countries so that the outcomes for women and for children's health, women's health, maternal health, reproductive health is met, then he should not be interfering. He should allow what can happen in certain countries happen and let that decision-making be done based on the needs of the patient and on what that country will allow to happen. He's not doing that. He's blanketing everything with his own ideology. And I'm back again to say this is dangerous.
We've heard a lot of ideology here. I wish the Conservatives were here. I'm sure there's an explanation, but they couldn't get someone here, so we'll leave it at that. Jean Crowder here in the studio, Hedy Fry in Vancouver, thank you very much for joining us.